Hi, it's Dr. Connie. A couple of you have reached out to me about issues with thyroid dysfunctions recently. And the thyroid is basically a small butterfly-shaped gland located at the base of your neck. It's part of a complex network of hormonal glands collectively called the endocrine system. And our endocrine system is responsible for coordinating many of our body's activities, including our metabolism. So common disorders are when the thyroid produces too much thyroid, which is hyperthyroidism, or not enough, which is hypothyroidism. There are 4 common forms of thyroid dysfunctions. One is Hashimotos. This is the most common cause of hypothyroidism in the United States, affecting approximately 14 million Americans. It can occur at any age, but most often affects middle-aged women. Hashimoto is an autoimmune condition where the body's immune system malfunctions to attack the thyroid gland and its ability to produce its hormones. Some individuals can have the condition for years with no obvious symptoms, while in some, it can cause a host of symptoms including fatigue, depression, constipation, mild weight gain and dry skin, intolerance to cold, etc. Second is Graves' disease. This condition is named after the doctor who first described it more than 150 years ago. It's the most common cause of hyperthyroidism in the United States, affecting about 1 in 200 people. Graves is also an autoimmune condition that affects the thyroid gland. Third is goiter. This is a non-cancerous enlargement of the thyroid gland. And the most common cause of goiter is iodine deficiency. It is estimated that goiter affects approximately 200 million people. And then fourth is thyroid nodules. Such nodules are growths that form on or in the thyroid gland. The cause of nodules is unknown, but iodine deficiency and Hashimoto's are suspects. Most nodules are benign, but they can also be cancerous in small cases. Most nodules don't cause any symptoms. However, if they grow large enough, they can cause swelling of the neck and lead to breathing and swallowing difficulties, pain, and of course, goiter. So let's talk a little bit about the adrenal gland. Adrenal gland produces adrenaline and manage our fight or flight response, but they also produce hormones that impact your metabolism, much like your thyroid. The hormones produced by the adrenals help our body regulate blood pressure, electrolyte balance, blood sugar, immune response, digestion, and much more. So stress and its effects on adrenals and thyroid is much dismissed in the conventional medical system. Stress is often hard to measure. When we're stressed, our hypothalamic signals or hypothalamus signals to our pituitary gland, which in turn triggers a signal to our adrenal gland to produce and release a series of hormones or stress hormones, including cortisol. The problem with this is when stress hormones are released, the body's priorities shift in such a way to deal with the stress. So various body functions such as digestion, immune response, and thyroid hormone production are put on hold until the stress is stabilized. In our connected world, stress is with us all the time, from the TV shows to news updates and social media feeds. And in most of us, the stress manifests as stress eating or adrenal fatigue. So let's talk a little bit about the thyroid hormone disruption. When stress is experienced, the surge in cortisol from adrenals results in a negative feedback from the hypothalamus and pituitary gland, so to slow function and in the process, slow the thyroid gland as well. So T4 to T3 conversion. These are thyroids that we measure. Stress hormones negatively affect the enzymes that convert the thyroid hormones from T4 to T3. This is important because free T3, also known as FT3, is the active form of the hormone, and reverse T3, also known as RT3, is the inactive form. When stress is high, we convert more T3 into RT3 or reverse T3 rather than free form of T3. This results in slowing all metabolic systems, causing hypothyroid. Next, let's talk about thyroid hormone disruption. So prolonged cortisol increase causes excess estrogen to pull in the body. This excess estrogen increases the level of thyroid binding globulin, also known as TBG, which is the protein that helps our thyroid hormones circulate in our blood. And when thyroid hormones are bound to TBG, they remain inactive, which in turn creates elevation of T4 because it can't be converted to the free T3, which is the active form. When we're stressed, it also causes immune system suppression. When we are stressed, our immune system is suppressed to focus its effort on overcoming the stress as well as to decrease the inflammation. It's this cascade of events that suppresses the immune system that can potentially trigger dormant infections, some of which can trigger an autoimmune disease. Next, let's talk about gut permeability, my favorite topic, also known as leaky gut. As mentioned, the cortisol surge suppresses our immune system and also weakens our body's main barriers to toxins, the blood-brain barrier and our gut barrier. The weakened gut barrier can cause gut permeability, which also can perpetuate or trigger an autoimmune condition. This leakiness can release various food particles like gluten or dairy, bacteria, and toxins into our blood, which also can cause an attack on your thyroid. So what can you do? Well, it's obvious how our body is intricately connected and how our adrenal gland plays a huge role in thyroid health. So a typical treatment for thyroid dysfunction is thyroid medication without consideration of your adrenals. And because the conventional medical system relies on a blood test for thyroid and adrenal levels, it's easy to miss this imbalance. Why is that? Because our hormones fluctuate throughout the day and are highly individual. If testing your adrenals, it's highly recommended that you test via the saliva test, along with the symptoms checklist to get the most accurate measurement. If you're interested in testing at Alkaline, we can send you the saliva kit and have the results within a few days. Please click below to request. So let's now talk about how to relieve stress and support the adrenal gland. So managing stress is the best way to relieve stress. We have tried and true tools and techniques to help you keep your stress under control. First of which is heart math. Our nutrition therapist, yoga therapist, and heart math practitioner, Leslie Lipsius, can help you get a handle on your stress by helping you with your breath, mind, and heart rate. She can help you create a calm and zen state utilizing our biofeedback device to measure your heart rate variability to know that you are making an impact on your health. Second is hot yoga. We know the benefits of infrared sauna, including stress relief and detox. But to add yoga movements to it, it truly is an amazing experience to help you get stronger, stable, calm, and more flexible. Third is meditation. Just 5 to 10 minutes of quiet meditation time will do wonders for your stress level and overall sense of calm. Fourth is gratitude journal. Keeping a journal of all things that bother you and noting what you're grateful for is the secret to having the most fulfilling, happy life. Fifth is alkaline supplements. Some herbs and adaptogens can help the body become more resilient to stress. I've used them in my healing regimen and have helped thousands of patients do the same. Click below for recommendations. A good quality multivitamin and probiotic will help to keep your body in good health and in turn help your adrenal health. A good quality omega-3 fatty acids, magnesium, and methylated B vitamins are essential to help your body recover or prevent adrenal fatigue. I do hope this was beneficial. Too often, patients come to me with thyroid medications and continue to struggle long-term with effects that further get the body off balance. Supporting your body takes knowledge, understanding, and guidance. It boils down to food as medicine, movement as medicine, and mindfulness as medicine, collectively the Alkaline method. Any above symptoms or dysfunctions would benefit from also our alkaline detox protocol. Please click below for more information. We've got hot yoga, Pilates, bar, aerial yoga, physical therapy, nutrition therapy, and functional medicine to help you look and feel your best. Please comment below with questions or subscribe to our YouTube, Facebook at Alkaline Method, at Lupus Rebel, and our Instagram at Alkaline Wellness and at Lupus Rebel. Thank you so much for watching. I'll see you guys next week.